Hey, today we're going to talk about gender specific, and the first one we're going to talk about is male, mainly dealing with the prostate. Okay, so why are these gentlemen at risk for BPH? It is because they're of older age, chronic alcohol use possibly, I don't know for sure, but I'm guessing, smoking, sedentary lifestyle, obesity, diets that are high in fat, protein, and carbs, and low in fiber. People that have a history of diabetes or cardiac disease are also at risk, at a higher risk. So look at where the prostate is. You can see on this side of the slide you've got the normal prostate and then you have the enlarged prostate. This is the bladder and then you have the ureter coming down. You can see as it enlarges it puts pressure on the ureter, so it's going to impact urinary stream, right? So what are the symptoms? Well, urinary frequency, urinary hesitancy, sometimes incontinence. They feel like they don't empty their bladder completely. They will dribble urine after voiding. They notice the force of their stream is decreased. They may have to strain to urinate. May develop hematuria. They have an increased tendency to develop urinary tract infections because of the fact that the bladder doesn't empty completely. The backflow of urine, if the obstruction is bad enough, can push up to the ureters and the kidneys, and therefore it can cause renal damage. You want to monitor the BUN and creatinine with this. Other labs you might see drawn or done on these patients, on these men, are urinalysis and urine CNS to see what's going on with the urine, if there's any issues there. You may see in your complete blood count a low RBC count because if they have hematuria, they've been losing blood. They're going to receive a digital exam, draw a PSA test, and they may also have an ultrasound done with a biopsy. So what can we tell people that have BPH, men that have BPH, how to deal with it? Like what kind of education that we might do? Well, one, you're going to mention to them that frequent ejaculation will decrease the size. So that has some benefits, right? They should also avoid when urging, they feel that urge. They should avoid caffeine and alcohol. And they should take no meds to decrease bladder tone. And this could be like antihistamines. So what kind of meds are these patients placed on? Well, the reason why we put them on the medications is to reestablish the urine flow. One classification is the DHT lowering medications. What's important with this classification is to note that it can take 6 to 12 months for it to work. So it's going to take a while for it to work. So we want to make sure that the patient understands that it's not going to be an overnight success. They also need to watch for signs of breast enlargement, that kind of stuff. Okay. And as you can see in the label here, this one proscar shouldn't be crushed or broken. Okay, so then the other one is the alpha blocking, like a Flomax. This will relax the bladder opening, which will make it easier for the patient to urinate. The biggest thing with this one as side effects is that it can cause postural hypotension. So if they're started on it, you definitely want to discuss with them about not getting up too quick, that kind of stuff. And if they are taking somatotine for GERD, it can actually increase the tendency of the blood pressure dropping, so they may want to switch off that. All right, so here's a question for you. After a prostatectomy, when should the urine turn to light pink? Is it A, B, C, or D? And the answer is B. After 1 day. After that first day post-op prostatectomy, the urine should turn to a light pink within 24 hours. If the prostate is enlarged enough, or maybe it's biopsied and turns out it's cancerous, they'll remove it. The most common surgical procedure is a TURP, transurethral retroperitoneal prostatectomy. Post-op, they're going to be on a continuous bladder irrigation. You can see a picture of it here. It's also known as a Murphy drip. In my world, that's what we call it. The rate is adjusted to keep irrigation flowing, and that our goal is to see the urine that it's either color pink or lighter pink. Okay. The irrigation bags are I think they're over 1,000 for sure. So we want to make sure that they're always full and that they're running. We're going to record the amount. If we notice that urine or irrigant or urine are not flowing through, or maybe clots, we can irrigate the tube per protocol. So we would have to see, each surgeon has their own way of wanting to do it, how many cc's to use, that kind of thing. So we would double check what the protocol is for the unit that we're on. Remember that this catheter has a large balloon, so if you're discontinuing it, these balloons can carry up to 30 to 45 cc's of fluid. So it's not like those little ones we did in foundations where 10 cc's of fluid, okay? Also, post-operatively, we want to monitor vital signs, check for bleeding, ambulate, and provide medications. Medications most often are pain medications, analgesics, as well as something to decrease bladder spasms as well. Upon discharge, we're going to encourage the patient no heavy lifting, no strenuous exercise, no straining, no sex for 2 to 6 weeks. They should drink lots of water. They should avoid non-steroidal anti-inflammatories because of the risk of bleeding. They should avoid caffeine and alcohol. If they notice as they increase their activity and they notice more blood in their urine, they should decrease the activity, kind of rest, and then increase fluids. If they notice that urine output has decreased, they should contact the physician and go see him. Okay, so one of the things we talk about is monitoring output when they have irrigation. So what you're doing is you have to keep track of how much irrigant has gone in. So that's the total amount. When you're draining the bag, the Foley bag, in that bag it's going to have irrigation liquid as well as urine. So you're going to get the total amount, and then you're going to subtract the amount of irrigation that has gone in during that time period. And then you get your total urine output. So that's how you determine it. Okay, so what you do is you get your total amount that you drain from the bag. So say you got 1,000 out, and then we know that 500 of the irrigation fluid went in. Then we subtract that, and then we have a total of 500 out of your... Okay, so here's another question for you. After having a transurethral resection of the prostate, a client returns to the unit with a 3-way indwelling catheter, otherwise known as a Murphy, with a closed bladder irrigation, CBI. Which finding suggests that the client's catheter is occluded? Is it A, B, C, or D? And the answer is A. It's very common for these patients to have increased bladder spasms or feel an urge to void around the catheter. And that usually could mean that there's something occluding that catheter and we need to irrigate that catheter. All right, so that is prostate, guys. Thank you.